in the disability field for 27 years, also lived with people and cared for people for 55 years with a disability. So I come from both sides of the fence. My biggest concern is about continuity of care. I understand and respect what you're saying about industrial matters being outside and need to be addressed elsewhere, but the gap in service, the gap in the cost, the unit cost and the real cost of a service is a real concern, and the ongoing having a disability workforce that is well paid, well qualified, well skilled is essential for carers and families, for reassuring, making sure we've got good quality of care. I just want to know how that's going to be addressed. As a family member, I think it's essential that this issue is responded to.
Jenn, are you from Santos?
I am, and if I can just briefly say, at the beginning of the year, every family member at Santos, you know, they all said they didn't want the services.
Sorry, I'm coming back up. You don't really need it, but you
sorry. Every family member said that they wanted the services to remain with the government and not go to the NGO. And I believe the reason for that was because they wanted a guarantee that staff that they knew, that they trusted, that the quality of care and support would continue with their family members moving out of the institution into the group homes.
And that's exactly right. There's people that have confidence in the care that has been provided for so many years, and have built up more than a professional, a caring relationship with the professionals who have delivered that service. What we've got to make sure is that as the system that transfers into the post-NDIA world, where individuals are funded, that they recognise that expertise, and that we don't have a situation where there's a cliff where the entire public sector workforce falls off that cliff when the NDIA rolls into town on crossover dates. That's why we want to sit down, separate from these negotiations, separate from these kind of forums, and work through with the Health Community Services Union, with CPSU, with the other unions involved as to what is needed in place to give effect to make sure that when that new world arrives, this community and lots of other communities, that professional workforce is accommodated and maintained, both its who and its numbers and its terms and conditions of employment. So that's the commitment that we are making, and I'm happy anyone to report it, put it on the web, do all those kind of things, because that's the position that we've written to all the industrial partners in this about, because if that Santos experience told me anything, it's that relationship built up over time is what we need to build on. It doesn't mean it's going to stay the same, because that will be beyond the control of governments. It will be a direct relationship between the person with disability, their carers and providers, and the services that they are choosing. But we want to make sure that the public sector workforce, which makes up about half the total workforce in Victoria at the moment, is in a position to continue on with that professionalisation from the highest possible standards.
Okay, thank you. Thank you. I hope